Most viruses don't kill you, your own body does. The deadliest viruses on Earth share one trick. They don't destroy your cells, they turn your own immune system into the weapon that kills you. Here's exactly what each one does to your body. Starting with the one almost nobody sees coming, Hantavirus. Hantavirus is an airborne virus, a microscopic killer that hides in dust. Most viruses need touch, blood, or fluids to spread. This one just needs a breath. It lives in rodents, deer mice in the Americas, field mice and voles across Asia and Europe. The animals never get sick. They shed it for life through urine, droppings, and saliva. When that material dries and breaks apart, the virus drifts into the air. Sweep an old cabin floor. Disturb a barn corner. That's all it takes. No bite, no contact, just a breath. Once inhaled, it travels to the lungs and slips into the bloodstream. From there, it targets your endothelial cells, the thin lining of your smallest blood vessels. Here's the strange part, it doesn't destroy them. It just hides inside. The damage comes from your own immune system, reacting too hard, attacking the walls from within. The vessels start to leak. Fluid that should stay in your veins floods your tissues. Hantavirus doesn't drown you. Your body does it for the virus. There are two forms, depending on the strain. The first attacks the lungs, Hantavirus pulmonary syndrome or HPS, found mostly in the Americas. The second attacks the kidneys, hemorrhagic fever with renal syndrome or HFRS, found mostly in Asia and Europe. The early phase is the same for both. 1 to 8 weeks after exposure, you feel like you have the flu. Fever, deep aches in the thighs, hips, and lower back, headache, chills, sometimes nausea. Nothing about it screams emergency. That's the trap. Most people go home, take ibuprofen, and wait. Then the second phase begins. In HPS, the lungs flood. Coughing turns to shortness of breath. Shortness of breath turns to the feeling of drowning while standing up. Oxygen crashes within hours. About 38% of confirmed HPS cases in the United States end in death. In HFRS, the kidneys fail. Blood pressure collapses. Eyes redden. The face flushes. The body bleeds from vessels that can no longer hold fluid. Survival is more common. Fatality runs from 1 to 15%, but recovery can take months. There is no antiviral, no cure. Treatment is supportive: oxygen, fluids, dialysis, ventilation. The earlier it's caught, the better. But most patients aren't diagnosed until the lungs or kidneys have already started failing. In February 2025, classical pianist Betsy Arakawa, wife of actor Gene Hackman, died of Hantavirus pulmonary syndrome at her home in New Mexico. Within weeks, 3 more residents of Mammoth Lakes, California died from the same disease. 2 of them had no known exposure to mice at all. The pattern keeps returning, every few years, in places people thought were safe. Hantavirus is rare, but rare doesn't mean safe. It only takes one breath of dust from a place you forgot mice had been. Marburg. Marburg is a hemorrhagic virus and the older sibling of Ebola. It was discovered first in 1967, a German laboratory in the city of Marburg, when workers handling imported African green monkeys started bleeding from their eyes. 7 of them died. It lives in Egyptian fruit bats, caves, mines, abandoned shafts, places where bats roost in colonies of thousands. People become infected when they breathe in air contaminated with bat saliva or droppings. From there, the virus spreads through human contact. Blood, fluids, even contact with a corpse during burial. Once inside the body, Marburg attacks endothelial cells, the same blood vessel lining that Hantavirus targets. But Marburg doesn't hide inside them, it destroys them. Your blood vessels start to leak from every direction at once, inside your stomach, inside your lungs, behind your eyes. The first symptoms hit within a week: sudden fever, severe headache, muscle aches that feel like the worst flu of your life. Then comes the bleeding. From the gums, from the nose, from the eyes, from every soft tissue in the body. There is no cure, no approved vaccine. Treatment is supportive: fluids, blood pressure support, isolation. Survival depends on how early you reach intensive care and on luck. Average case fatality is around 50%. In recent outbreaks, it has run higher. Tanzania reached 89% in early 2025. Equatorial Guinea, Rwanda, Tanzania, and Ethiopia have each reported a Marburg outbreak in the last 3 years. Ethiopia's was the country's first ever. 14 confirmed cases, 9 deaths, declared over in early 2026. Experimental vaccines are now being tested in real outbreaks. The Sabin Vaccine Institute deployed more than 600 doses of an investigational shot to Ethiopian healthcare workers in late 2025. A monoclonal antibody therapy called MBP91 entered the same outbreak. Neither is approved yet. Marburg has no famous name, it has no movie, it just kills in waves in countries the news rarely mentions. And it's still here, Nipah. Nipah is a brain virus. It doesn't go for your blood vessels or your lungs. It goes straight for your central nervous system. It lives in fruit bats, flying foxes, across South and Southeast Asia. The bats drink from date palm sap collected in open clay pots overnight. Their saliva and urine contaminate the sap. In the morning, farmers harvest it and people drink it raw. That's how Nipah enters the human body in Bangladesh and India almost every year. It can also pass through pigs. The first known outbreak in 1999 swept through Malaysian pig farms and killed more than 100 farmers. Once Nipah is in humans, it can spread directly between people through saliva and respiratory droplets, making it one of the few hemorrhagic tear viruses that doesn't need an animal reservoir to keep going. Once it reaches the brain, the virus inflames the lining and the tissue itself. The result is encephalitis, brain swelling. Confusion comes first, then severe headache, then drowsiness, then disorientation. Some patients fall into a coma within 48 hours of becoming sick. Others develop seizures. Some experience hallucinations and personality changes that don't fully reverse, even in survivors. Case fatality runs from 40% to 100%, depending on the strain. The Bangladesh strain consistently kills 70 to 90% of the people it infects. In 2025, Kerala, India reported 4 confirmed cases. 2 were fatal. Bangladesh reported 4 fatal cases the same year. There is no cure, no vaccine approved for human use. The World Health Organization classifies Nipah as a priority pandemic potential pathogen, a virus close enough to spreading further that the world is watching. You can survive Nipah. But survival often means months of recovery from neurological damage that may never fully heal. Ebola. Ebola is the most famous deadly virus on Earth, and the most efficient at killing through fluids. It lives in fruit bats. It crosses to humans through butchered bushmeat, contact with infected wildlife, or close care of the dying. Then it spreads through every fluid the human body produces. Blood, saliva, sweat, tears, even sweat-soaked clothing left behind on a hospital bed. Once inside, Ebola attacks immune cells first, the very cells designed to fight infection. It hijacks them, multiplies, and rides them through the bloodstream into nearly every organ. The liver, the kidneys, the spleen, the lining of every blood vessel. Wherever blood goes, the virus follows. The first symptoms appear within 2 weeks of exposure. Sudden fever, severe weakness, muscle pain, sore throat, then diarrhea, vomiting, and rash. Then the bleeding, internal and external, from the gums, the eyes, the rectum, even the puncture sites of every needle inserted to try to save you. Death comes from organ failure and shock. Case fatality rates run from 25% to 90%, depending on the species and the outbreak. The 2014-2016 West Africa outbreak killed more than 11,000 people across Liberia, Sierra Leone, and Guinea. In 2025 alone, 2 new outbreaks struck: Uganda from January to April, and the Democratic Republic of the Congo from September to December. The Congo outbreak killed 45 of its 64 confirmed and probable patients. A 70% fatality rate. 2 vaccines now exist: Ervebo, given as a single dose, and the 2-dose Zabdenomvibia regimen. More than 47,000 people were vaccinated during the Congo outbreak alone. Experimental antibody treatments now exist for active infection. Ebola is no longer a death sentence, but it still kills more than half of the people it reaches in most outbreaks, and every few years it crosses back into humans from the bats it has always lived in. H5N1. Bird flu. H5N1 is an influenza virus, the same family of viruses most people catch every winter and recover from. But this strain doesn't infect humans easily, and when it does, it kills nearly half of them. It lives in birds. Wild waterfowl carry it without becoming sick. Chickens and other poultry catch it and die in mass die-offs that have killed more than 167 million farmed birds in the United States alone since 2022. People who handle infected birds are at risk. So are people who drink raw milk from infected dairy cattle. a transmission route that didn't exist until 2024, when H5N1 jumped to American dairy herds for the first time in history. Once inside the human body, H5N1 binds to receptors deep in the lungs, places ordinary flu can't reach. From there, it triggers a cytokine storm, your body releasing so many inflammatory chemicals at once that it damages your own organs. Lungs fill with fluid, blood pressure crashes, multiple organs begin to fail at the same time. Symptoms start as fever, cough, and severe muscle pain, often within 5 days of exposure. They escalate fast. Pneumonia, respiratory failure, death within 2 weeks for nearly half of confirmed cases. Since 2003, the World Health Organization has recorded 986 confirmed human cases of H5N1 worldwide. 473 of them died. That's a case fatality rate of 48%. In January 25, a man in Louisiana became the first person in the United States to die of the virus. More than 70 American human infections have been confirmed since 2024. H5N1 cannot yet pass easily from person to person. If it ever mutates the ability to do so, the world will be staring at a flu pandemic with the death rate of Marburg. That is the scenario every epidemiologist watches for. Every day, smallpox. Smallpox killed an estimated 300 million people in the 20th century alone. By some estimates, it killed more humans across all of history than every war ever fought combined. It was caused by the variola virus, transmitted through respiratory droplets. A single infected person could spread it to dozens. Once inside the body, the virus traveled through the bloodstream and into the skin, producing fluid-filled pustules across the entire body. The face, the hands, the feet, the inside of the mouth, the inside of the throat. The pustules ruptured and crusted over. Around 30% of the people who caught it died. Most who survived were left scarred, blind, or both. For thousands of years, smallpox was a force of nature. It collapsed empires. It traveled with explorers and killed indigenous populations across the Americas. It outlasted plagues, famines, and entire civilizations. In 1796, an English doctor named Edward Jenner noticed that milkmaids who had caught a milder cattle disease called cowpox seemed protected from smallpox. He used material from a cowpox sore to inoculate a healthy boy. The boy survived a deliberate smallpox exposure unharmed. That was the world's first vaccine, named for the Latin word for cow, vacca. For nearly 2 centuries after, vaccines spread. Then mass vaccination campaigns. Then a coordinated global eradication push. The last natural case of smallpox was diagnosed in Somalia in 1977. The World Health Organization declared the disease officially eradicated in 1980. Smallpox is the only deadly virus humans have ever beaten. The only one that lives on as a story instead of a threat. The variola virus still exists in only 2 known places on Earth. A freezer at the CDC in Atlanta and a freezer at a Russian research facility outside Novosibirsk. We won. Once. Rabies. Rabies is the deadliest virus on Earth. Once symptoms appear, it kills nearly 100% of the people who catch it. Not most, almost everyone. It lives in the saliva of infected mammals, usually dogs in Asia and Africa, where most human deaths happen, or bats and raccoons in the Americas. A bite, a scratch, even a lick on broken skin or in the eyes can transmit it. The virus enters at the wound and stays local for days, sometimes weeks. It does not yet enter the bloodstream. It travels through nerves. It moves slowly along peripheral nerves toward the spinal cord, then up to the brain. By the time it arrives, the immune system can no longer reach it. The brain has no antibody factory. The blood-brain barrier that once protected you now protects the virus. Incubation usually takes 1 to 3 months. In rare cases, more than a year. During this time, you feel completely normal. You might forget the bite ever happened. Then the symptoms begin. The first signs are subtle: fever, headache, tingling at the site of the original wound. Then the disease accelerates. Anxiety, agitation, confusion, hallucinations. The classic symptom, hydrophobia, where the sight or sound of water triggers violent involuntary spasms in the throat. The brain is dying, the personality dissolves. Within 7 to 10 days of the first symptom, almost every untreated patient is dead. The terrifying part is that rabies is preventable. If you receive post-exposure treatment, wound cleaning, the rabies vaccine, and immune globulin within hours or days of the bite, before symptoms begin, you will almost certainly survive. Once symptoms begin, no proven treatment exists. For 2 decades, doctors hoped a method called the Milwaukee Protocol, induced coma plus antiviral drugs, could save symptomatic patients. The treatment was named after a Wisconsin teenager who survived rabies in 2004. As of 2025, the medical community has largely abandoned it. Most attempts to repeat that survival have failed. Researchers note that several so-called survivors may not have had the fully progressed disease. Out of roughly 34 documented rabies survivors in human history, most are left with permanent neurological damage. A new generation of monoclonal antibody treatments is being tested in animal models. Whether they will save symptomatic humans is still unknown. Rabies kills around 59,000 people every year, mostly children in countries where dog vaccination is rare. It is one of the oldest diseases in human history, and once it reaches the brain, it is still as fatal today as it was 4,000 years ago. 7 viruses, 7 different doors into the body. Hantavirus through a breath of dust, Marburg through a corpse, Nipah through a sip of palm sap, Ebola through a tear, H5N1 through a breath of barn air, Smallpox through a cough that no longer exists, rabies through a bite you might not even remember. What they share is the trick from the start of this video. Most don't kill you. They turn your own immune system, your own blood vessels, your own brain into the weapon. The viruses just point. Modern medicine has beaten one of them. We have vaccines for 2 more. The other 4 are still waiting, in bats and rodents and birds and dogs, for the next door to open. If this taught you something, the next video covers every virus that has killed the most people in history. Subscribe so you don't miss it.